Well, South African virologists say the Mpox outbreak in Africa was neglected and it could now turn into the next global pandemic. President Cyril Ramaphosa expressed deep concern about the rapid spread of the disease across the African Union region. Last week, 3 additional countries notified cases under investigation for confirmation, which brings the total to 16 countries in which Mpox has been detected. To speak more on this, let's now welcome Professor Adrian Puren, Executive Director of the National Institute for Communicable Diseases. Prof, thank you so much for your time this afternoon. So the Africa Centers for Disease Control and Prevention, as well as the WHO, they've announced that the Mpox virus is a public health emergency of international concern. This, as the cases, as we've heard, continue to rise in the continent. Just talk to us about what the current status in our country is. I mean, how concerned should we be?
Yes, so at this time in South Africa, we should not be panicking. I think we're part of what is called the first wave, if you like, of the multi-country outbreak that had affected multiple countries since 2022. In other words, there's been about just under 100,000 cases as part of that particular outbreak that has been reported since 2022. And in South Africa, we certainly had about 5 cases in 2022. There were no cases reported in 2023. And currently, we have 24 cases, 3 of whom have demised as a consequence of these infections. So within South Africa, there's certainly been a great deal of preparation in different aspects in order to try and limit transmission in the country. And these efforts certainly continue. So it's a multi-sectoral approach that involves both the National Department of Health, the provinces in terms of the departments of health, as well as other partners such as, for example, the National Institute for Communicable Diseases, as well as those organizations that work with communities that may well be affected, especially as we've seen that in South Africa, the severe cases that we have seen are primarily those individuals who have immune deficiencies, in other words, HIV, who have either do not know their status and or who know their status but may be poorly controlled. And that a consequence of that is that there have been severe presentations of at least within that particular group.
Well, that is comforting to know in terms of how South Africa is currently dealing with this matter. Just in terms of, the cases that we have, just to get some clarity. So of the 24 cases recorded in the country, 3 have died, of course, and there have been several recoveries. But the 2 active cases are still undergoing home isolation. Just talk to us, Prof, about what that exactly entails.
Yes, so there may not always be severe cases. I think we just need to be aware of it. There's a spectrum of disease presentation. And if there are opportunities that does not require hospitalization, then of course, home isolation is an option. And in those particular settings, of course, you want to make sure that they report regularly in terms of the development of symptoms such as fever, lymphadenopathy, the development of rash, or further developments of rash or worsening of their particular condition. And that within that particular setting, if there are household contacts, how to manage those particular household contacts in terms of contact with each other, the utilization of particular elements such as cooking or exposures in terms of surfaces and how to clean them, and of course bedding and clothing, for example, as well. So there'll be a whole set of pieces of information that are really critical to supply to the individual as well as the household to ensure that onward transmission does not occur. Of course, within that household, if there's been close contact, those individuals as well will be under observation. And if they develop signs and symptoms, that those should be reported. And in fact, one would like to make a diagnosis whether or not they are certainly infected and then manage it appropriately.
There are also concerns, that the initial Mpox outbreak in the continent was not attended to with the urgency that was needed. I mean, this has resulted, we're hearing in some reports, in Mpox spreading and mutating into a different strain. More than 17,000 cases have now been reported across the continent. How confident are you that, further mutations can be averted, or is that inevitable?
Sometimes mutations are inevitable. They don't necessarily mean that you now have a more virulent virus, but it's certainly very key, and that's why the announcement of a public health emergency is so critical, because that focuses the minds of multiple countries, multiple agencies, to ensure that we can better understand and respond to this particular outbreak in the DRC and the other affected countries. So an epidemiological understanding is really going to be really critical as to why those numbers certainly increased within that space of time, and who is affected. So again, I think there's a range of individuals compared to the first multi-country outbreak, which affected mainly adults. We know that endemic transmission, as well as in this particular scenario in the DRC, that there's a spectrum of age groups that are affected. Certainly there were the social and sexual networks that are thought to have played an important role, but there may be other factors as well, including the fact that, in fact, and we know that this particular virus strain is different to the Mpox that was seen as the multi-country outbreak. Although it is endogenous, it's clade 1 that is of now concern. It's really understanding, again, what is it about this particular virus or the ecology that has changed for us to see these numbers of cases. So again, it's very important that our responses are focused on the epidemiology, the public health knowledge. That's really important, the diagnostics, the access to treatment and access to vaccines, and therefore that health emergency plays this particular role to really coordinate these responses to the different aspects for us to understand and prevent the transmission rates that we are currently seeing.
And to what extent then does that public health emergency of international concern align itself with, just the pandemic prevention? I mean, you've spoken at length about preparedness and the response, but what about prevention? I mean, a lot asking, could that not have been foreseen? Yep. Could we not have closed our borders quicker? Or, just having our eyes on the ball, given the fact that we do come from a devastating COVID-19 virus?
Yeah, so again, the idea is not to close borders. I think you're quite right. It's really about providing information to the public. It's important that we have critical tracing and tracking and diagnostics. So I think all these particular aspects, you're quite right. In Africa, there has been endogenous circulation of this virus for numbers of years, but in terms of our responses globally, that has certainly been lacking. And so again, it's really unfortunate, but I think we find ourselves in this particular situation where, again, we're seeing this rapid increase in cases. What is the cause of this, and how do we prevent it? So again, you're quite right. Prevention is really going to be the key. We should really be focusing on the identification of cases, in terms of trying to isolate where we can. But these are really challenging, as you know, from COVID-19, when these particular messages were being relayed and conveyed to the public. How do they respond to that? And how do we make them responsive to these particular messaging that we think is really critical in terms of prevention? So it really is challenging. And as you quite rightly point out, what's happening with this particular virus, and it's really critical for us to come to terms what's actually happening with this particular virus as well.